For many years, the issue of racial health disparity was not our main focus. It was one drug fits all. But we know now that that's not the case, and people respond differently because of genetic backgrounds. African Americans have different genetic makeups than Caucasians, specifically in a number of genes that are involved in tumor progression. And with colon cancer, we know that the mortality rate for African Americans is actually 40% higher. So as an African American scientist, knowing that we are more susceptible to it, I actually feel a greater burden to look at what makes us different. Overall, what I'm trying to do in the lab is find a cure for cancer. But it's not something that I could do by myself. It's something that requires a collaboration.
In order to be confident about your conclusions, it all comes back to numbers. The more biospecimens you examine, the more likely you can make conclusions that you know are real.
Stony Brook is a great place, but the population is predominantly Caucasian. So partnering with SUNY Downstate allowed us to accumulate enough tissue so that we now have a sample size large enough for statistical measurements.
Despite, the great strides that we've made in cancer research, we still have a lot more work to be done. And we cannot get there without this collaboration. As the only medical school in Brooklyn, we are very fortunate to have one of the larger minority populations in the New York area. And so our primary contribution is providing the biospecimens from underrepresented minorities. What we're trying to do is build a whole picture of the cancer itself.
Cancer health disparity has been well known. African Americans have higher mortality and a higher incidence. But if you really want to attack this problem, you have to look at everything. So by using a living biobank that can be tested for drug sensitivity and early biomarkers, we're trying to tease out what is the difference. And all the sequencing is being done at Cold Spring Harbor.
I am intensely curious. I find myself always asking why about everything. I'm never satisfied by an answer. I'm always looking for something deeper, and that has been a motivation for me. Most of what we know about cancer, and colon cancer in particular, is from looking at cell lines. And those are very good models of disease, but they don't teach us what happens in a hospital in real life. Cold Spring Harbor Lab have an extensive expertise in analyzing DNA. So it's essential for a research lab like us to partner with institutions like Stony Brook and SUNY Downstate that have access to those patients, so that we can combine all that information together in a meaningful way to hopefully drive treatment. It's always about improving patient care.
With the resources that we now have access to at Stony Brook University and Cold Spring Harbor Laboratory, we have been able to carry out the work that in the past I could only dream about doing.
The more we dig into cancer, the more we realize how complex it is. We need a global effort amongst the different cancer centers. And this program, spearheaded by Drs. Ellen Lee and Jenny Williams, is a strong collaboration between our investigators and investigators at SUNY Downstate and Cold Spring Harbor. They're dedicated people working together, removing obstacles, and we are making larger and larger dents against cancer.
Racial health disparity exists, and there is a mechanism for studying it.
There's no one else really focused on increasing this representation. So it's absolutely essential for us to try to address this disparity. Because if we don't do something about it, there's no one else going to do it.